Hello everyone and welcome to day 2 of week 8. Now, if you remember from the day 1 video, I said that we had 3 chapters to discuss this week. We had chapters 53, 54, and 55. In the day 1 video, I had discussed chapters 53 and 54. So for the day 2 video, I'm going to focus on chapter 55, which is dealing with medication administration. This chapter really helps to focus on the understanding of how to give the different kinds of medication and all the forms that medication can come in. So let's jump in and get started. Medication can be administered in several different forms. You have oral, topical, rectal, by inhalation, or by injection. When we talk about oral medications, these are medications that are swallowed and enter the tissues of the GI tract. Then they get absorbed and out into your circulatory system. So any oral medication will be absorbed by the GI tract first. These can be items such as pills, syrups, or other liquids. Under oral, you also have sublingual, which will go under the tongue and be absorbed that way, and buccal, which will get absorbed on the inside of the cheek into those mucous membranes. Topical medications are used for dermal application or mucosal application. For the dermal application, this will be put onto the skin, soaked through the skin, and then into your circulatory system. So those could be things such as creams, ointments, lotions, or skin patches. Mucosal applications would go into the mucous membranes and be absorbed that way, then into the circulatory system. Those could be things such as eye drops, ear drops, or nose drops, eye ointments, vaginal creams, rectal or vaginal suppositories, and then sterile douche solutions. It's very important that you understand when you are administering any form of a topical medication, you should be wearing gloves so that way you don't absorb the medication once you are trying to put it onto the patient. Rectal medications would be something that would go in through the rectum, and they very similar to like a suppository, and they would be absorbed into those mucous membranes. Inhalation means that it's going to be an aerosol that you will ingest, much like inhalers. They go into your respiratory system and then are then dispensed out through the circulatory system. And the last way would be by injection, and this is also called parenteral. This means that the medication is administered outside of your GI tract. We usually give these medications directly into the bloodstream, so if you make an error, it's more deadly than that of an oral medication, because instead of being digested first, it goes straight into the bloodstream. The ways that you can administer a parenteral medication are intramuscularly, subcutaneous, or intradermal. You also will have a Z-track, which is very similar to that of an intramuscular injection. So let's look at all 3 of those a little bit more. Intramuscular injections are given directly into the muscle tissue at a 90-degree angle. The 4 sites that are most commonly used for intramuscular injections are your deltoid muscle, or the upper part of the arm on the outer surface, the vastus lateralis muscle, which is the outer portion of the thigh. This is what we generally use for our children and pediatric immunization. The dorsal gluteal muscle, which is the upper outer quadrant of the buttocks. We could usually give that for some sort of hormone therapy. And then ventral gluteal muscle, and this is given in the iliac crest of the leg. Pain medicines will be administered that way because there's a little bit more tissue to take on that medication. Subcutaneous is the second type. and this is given just under the skin in the fat tissue of the arm. It is used for small doses of non-irritating medication, and the most common place is going to be the back of the arm. It can also be the upper back or the abdomen, as well as the thighs. So, for example, if you did it in the abdomen, it would be for like a heparin or an insulin injection for diabetic patients. And the third type is the intradermal, which is most commonly used for allergy or TB testing. And this medication is administered within the top layer of skin. And when you do that, what you will actually see appear is what we call a wheal, which is really just a bubble under the skin. Now, when we're talking about giving TB testing, sometimes that TB test can turn red around the injection site. Redness does not mean that it is a positive result. The only way to determine a positive result for a TB test is if there is a hard lump underneath the skin. That lump is then measured to determine the size of the wheal to determine the TB testing results. So please remember, redness does not mean that you have TB. When you are administering medications, it's always important to follow the 3 befores, which state that medication must be checked 3 times prior to administering it. The 3 befores are before the medication is removed from the medicine cabinet, before the medication is poured, drawn up into a syringe, or placed in a medicine cup for oral injection, and before your medication is returned to the cabinet. So you really should be checking those 3 times to make sure that you haven't made a medication error. And sometimes it's best to always have a second set of eyes look with you or check your work. Along with the 3 befores are 7 rites of drug administration that are very important to keep the safety of our patients. Those 7 rites of administration are right patient, right drug or right medication, right dosage, right route, right time, right documentation, and the right to refuse. Please know that patients always have the right to refuse any sort of treatment if they do not want it. Now, because most likely medical assistants will be responsible for administering injections, it's important that you know the forms that these medications can come in. They can come in vials, ampoules, pre-filled syringes, and powders. Let's take a closer look at each of those. The most common one that you will come in contact with is a vial. Vials can either be single-dosed or multi-dosed. They can come in glass or plastic, and they have a rubber stopper at the top. Please note that if you have a multi-use vial, you will have to clean the vial's top every time before you use it so you don't have cross-contamination and potentially infect the patient with something that they don't need. Ampoules are small sealed glass bottles that contain a single dose of a medication. Now, because they are a sealed glass bottle, you will have to break open the top of the medication. What that means is that you're going to take a cotton ball or a cotton pad or an alcohol pad, and you will simply pop and break off of the top of the stem to be able to draw up your medication. Because it is a glass vial, essentially, you will need to use a filter needle to draw up your medication, so that way you don't have any glass particles that go into your injection for your patient and inject them with little glass particles. The filter needle will keep that out so you don't have that issue. Pre-filled syringes are wonderful devices that are put in place. These are really syringes that are already containing a medication, and all you have to do is put on a needle. There's no error that can happen with any drawing up, but you still really need to make sure that you have a second set of eyes that verifies it's the correct medication, because you don't want to have a problem with a look-alike, sound-alike medication, grab the wrong one, and inject the patient with the wrong medication. because like I stated earlier, those medications go directly into the bloodstream, so if an error is made, it's harder to stop the side effects that could happen. Pre-filled syringes are very convenient for medical assistants because it does not mean that you have to draw up a medication. You simply need to put on an inject needle, and off you go. And the last one is your powder medication. Now, if you have a powder medication or powdered form of medication, it will need to be reconstituted. What that means is that the medication will come with a diluent or a sterile water solution. You will have to draw up the sterile water solution first, transfer it into the powder solution, mix the two together until you get the powder into an all-liquid formation, and you can draw up the new formed medication, change your needle, and then inject your patient. Alright guys, so that is really kind of a brief overview of the chapter that we have for this week for day 2. We will actually start working with giving injections this week. Yay, I know some of you are really excited and some of you are not really excited, but we're going to get lots of practice doing that this week. So come in prepared. I say it's best if you wear a t-shirt, but I'm not saying you can't wear a long sleeve shirt. We'll just have to pull your arm out of it. Alright guys, come in ready to do some of the fun stuff, and I will see you on day 2 of week 8. Bye.